The Pap test is designed to look for small changes in the cells of your cervix. The cervix is the lower part of your uterus that connects to your vagina. During the examination, a speculum is placed in the vagina. Then the outer cells of the cervix are gently scraped. The cells are then sent to the lab for evaluation. Although possibly uncomfortable, the examination rarely causes more than mild discomfort and lasts only about a minute. Because the test can detect even very minor changes in the cells of your cervix, it can often identify a problem, including cervical cancer, in its earliest and most treatable stages. It's important to know that the Pap test will very frequently detect problems before you are experiencing any symptoms at all. Separate from the Pap test, HPV, short for human papillomavirus, is also commonly tested during a female examination. HPV is a virus that can be spread during sexual relations and is the most common cause of cervical cancer. An abnormal Pap or HPV test result does not necessarily mean that you have cancer of your cervix. A repeat test or additional testing may be needed to properly identify why the cells are abnormal. Your doctor will consider the results of the Pap test and the HPV test to determine if any further testing is necessary and when your next regular test should be scheduled. Be certain to ask your physician if you're up to date with your Pap tests. The blood glucose test measures the amount of a type of sugar called glucose in your blood. Glucose comes from carbohydrate foods, of which there are two types. Complex carbohydrates, found in foods such as pasta, vegetables, cereal, and breads, and simple carbohydrates, also known as sugar, found in fruits, milk, desserts, and candy. Glucose is a main source of energy for the body. After you eat, the sugar level in the bloodstream will rise. This causes insulin, a hormone that is produced by your pancreas, to be released into the bloodstream to quickly bring the level back down. In those that develop diabetes, sugar levels do not fall back to normal after meals. High blood glucose over time can cause permanent damage to the body, including vision loss, kidney damage, and heart disease. There are several conditions that may increase your risk for developing high blood glucose. These include a family history of diabetes, being overweight, and having high triglycerides, a blood fat. Women who have had large babies, over 9 pounds, and those with high blood pressure are also at increased risk. Abnormally high sugar in the bloodstream can cause several symptoms, including blurred vision, excessive thirst, weight loss, and becoming increasingly tired. In many, however, high sugar may cause very minor or no symptoms at all. Because of this, testing for glucose is recommended as part of your routine health care. Osteoporosis, which means porous or leaky bone, is an illness that weakens the bones due to the loss of bone thickness and strength. Having thinner bones may cause a fracture or make it easier for you to break a bone should you fall. There are several health issues that can put you at increased risk for developing osteoporosis. These include smoking cigarettes, not enough calcium in your diet, and not exercising regularly. Very thin women and those with a family history of osteoporosis are also at increased risk. A bone mineral density test is used to measure the thickness of the calcium in your bones and detect osteoporosis. You can think of it as showing how solid, stable, and strong your bones are. During the test, very low levels of X-ray are used to scan the bones of your hip and spine. The results are then compared to the bones of a healthy 30-year-old to give you a score or a result. A bone density test can be used to see if your bones are thin, measure changes in your bone thickness over time, and to measure the effect of medication that you may be taking for your bones. Because bones may become thin without any symptoms, it's important for you to have your bone density checked when recommended, as part of your routine health care. In order to prevent the thinning of your bones, a calcium supplement is generally recommended. Be certain to ask your physician about your risk for osteoporosis and the bone density test. Colorectal cancer is cancer that develops in the colon or the rectum. Although it's currently the second leading cause of cancer in the United States, it can be prevented. Cancers in this area almost always develop from a benign, non-cancerous growth in the lining of the intestine called a polyp. Although polyps may occasionally cause blood in your stool or abdominal pain, they frequently occur with no symptoms at all. Because of this, it's important for you to be screened for colon cancer as part of your routine health care. Now, one way to check for polyps or other colon conditions is to have a colonoscopy. In this test, a thin instrument containing a camera is used by a physician to see your rectum and entire large intestine. A colonoscopy is generally performed in a surgical suite while you're sleeping. While there is preparation required the day before the test, the actual procedure is usually completed in less than an hour. Now, another way to be screened for colon cancer is to have a sigmoidoscopy. This test uses an instrument that is similar to, but much shorter than the one used for colonoscopy. It allows a physician to see the rectum, but only a small segment of the colon. When a sigmoidoscopy is done, a patient generally is asked to have their stool checked for microscopic blood. This is done with a special kit that your physician will provide. The best way to be screened for colorectal cancer will often depend on a patient's personal medical history. Be certain to ask your physician which test would be best for you.